Seizures represent intricate neurological events characterized by abnormal, excessive, and hypersynchronous discharges originating from the central nervous system. Although seizure and epilepsy are frequently employed interchangeably, it is essential to discern between them. A solitary seizure occurrence does not inherently signify epilepsy, which denotes a chronic disorder typified by recurrent seizures. This segment aims to delve into the diverse classifications of seizures, elucidate their symptomatic manifestations, and delineate the suitable avenues for treatment. Partial seizures manifest as localized disruptions within specific regions of the brain, varying in their presentation and impact on consciousness. Simple partial seizures, referred to as focal onset aware. These episodes affect a small, delimited area of the brain while preserving the individual's awareness. Despite consciousness remaining intact, fluctuations in mood, perception, and sensory experiences like hallucinations or déjà vu may occur. Complex partial seizures. As the focal point of neuronal activity expands or disseminates, consciousness may become partially impaired. Termed focal onset. Impaired awareness seizures. These events entail involvement of broader brain regions, potentially encompassing an entire hemisphere. Patients may display automatisms, amnesia, and alterations in mood or perception. Partial seizures with secondary generalization. Initially localized, both simple and complex partial seizures can progress to involve widespread brain regions, culminating in a secondary generalized seizure. Known as focal to bilateral seizures, this transformation prompts electrical discharge propagation across both brain hemispheres, often resulting in tonic-clonic grand mal seizures. Generalized seizures entail extensive disruptions across the entirety of the brain, showcasing distinctive characteristics and manifestations. Absence, petit mal, seizures. These generalized seizures entail a brief loss of awareness or consciousness, typically lasting less than 30 seconds. Electroencephalogram EEG readings exhibit characteristic 3 Hz spike and wave discharges. Patients may display a vacant stare and engage in automatisms, albeit without experiencing a postictal phase marked by confusion or lethargy. Tonic-clonic, grand mal, seizures. Emblematic of the grand mal seizure, this event unfolds in 2 phases, tonic and clonic. The tonic phase features muscle rigidity, succeeded by the clonic phase characterized by rhythmic muscle contractions and jerking. Patients invariably lose consciousness and may manifest autonomic symptoms such as hypertension, tachycardia, and hypersalivation. Subsequently, the postictal phase ensues, marked by confusion, disorientation, and lethargy. Lennox-Gastaut syndrome. This pediatric epileptic disorder encompasses a spectrum of seizure types, including infantile spasms, tonic, myoclonic, atonic, and absence seizures. Frequently associated with developmental delays, Lennox-Gastaut syndrome is correlated with diverse genetic mutations, brain malformations, or infections. When addressing seizures pharmacologically, healthcare providers often prescribe anti-epileptic drugs, AEDs, tailored to individual patient needs. Common medications in this category encompass valproic acid, carbamazepine, lamotrigine, and topiramate. However, these drugs necessitate vigilant monitoring due to potential side effects, including liver toxicity, agranulocytosis, and teratogenicity. Status epilepticus poses a critical medical emergency marked by persistent seizure activity spanning 5 to 30 minutes. Immediate intervention is imperative and involves securing the airway, administering intravenous IV benzodiazepines, and escalating treatment to IV phenytoin or phosphonetoin if the seizure persists. Distinguishing psychogenic seizures from authentic seizures hinges on the absence of a tonic phase and normal prolactin levels. Conversely, febrile seizures, characterized by convulsions during episodes of fever in children, are typically self-limiting and seldom necessitate long-term anti-epileptic medication. Generalized seizures involve widespread electrical activity across the brain, resulting in distinct phases. 1. Tonic phase, the initial stage of a tonic-clonic seizure, characterized by sudden muscle rigidity and stiffening throughout the body. This phase may cause the person to fall if standing. 2. Clonic phase. Following the tonic phase, the seizure progresses to the clonic phase, marked by rhythmic, alternating muscle contractions and relaxations. This results in visible jerking and twitching movements of the limbs. 3. Postictal. After the seizure subsides, the postictal phase sets in. During this period, the individual may experience confusion, disorientation, and lethargy as the brain and body recover from the intense neurological activity. The postictal phase can vary in duration and severity depending on the individual and the type of seizure. Managing seizures with medication involves navigating potential risks and side effects associated with anti-epileptic drugs. 1. Valproic acid. While effective in controlling seizures, valproic acid carries the risk of hepatotoxicity and acute pancreatitis, necessitating regular monitoring of liver function. Additionally, it is a known teratogen, posing risks during pregnancy and requiring careful consideration in women of childbearing age. 2. Carbamazepine. This anti-epileptic medication can cause rare but serious adverse effects such as aplastic anemia, agranulocytosis, and syndrome of inappropriate antidiuretic hormone secretion, SIADH, which can lead to hyponatremia. It may also interact with oral contraceptives, reducing their effectiveness and potentially leading to unintended pregnancies. 3. Common side effects. Both valproic acid and carbamazepine are associated with common side effects such as rash, ataxia, loss of coordination, and nystagmus, involuntary eye movements. Topiramate, another anti-epileptic drug, may also increase the risk of kidney stone formation and metabolic acidosis. Balancing the benefits of seizure control with the potential risks and side effects of these medications is essential in providing effective treatment while minimizing harm to patients. Regular monitoring and close collaboration between healthcare providers and patients are key to optimizing seizure management and medication adherence. Febrile seizure. Occurring typically in infants and children during episodes of fever, febrile seizures are brief, lasting around 15 minutes on average. They are considered self-limiting and typically do not significantly increase the risk of developing epilepsy later in life. Consequently, anti-epileptic medications play a minimal role in the management of febrile seizures. Status epilepticus. This is a medical emergency characterized by prolonged, uninterrupted seizure activity lasting between 5 to 30 minutes. Immediate intervention is essential and involves securing the patient's airway, administering intravenous benzodiazepines as the first-line treatment to halt seizure activity, and escalating to intravenous phenytoin or fosphenytoin if the seizure persists beyond the initial treatment. Prompt and appropriate management of status epilepticus is crucial to prevent potential complications and minimize the risk of long-term neurological damage. Psychogenic seizures can be distinguished from authentic seizures by the absence of a tonic phase and normal prolactin levels, indicating the patient's awareness of the event. These seizures are often triggered by psychological factors rather than underlying neurological conditions. Febrile seizures occur in infants and children in conjunction with a fever, are self-limiting, and typically last around 15 minutes on average. They do not significantly increase the risk of developing epilepsy later in life, and anti-epileptic medications are generally not indicated for their management. Seizures can be broadly classified as partial, which affect a localized region of the brain, or generalized, involving widespread electrical activity across the brain. Various subtypes exist within these categories, each with distinct associated symptoms and manifestations. Understanding the different seizure types is essential for accurate diagnosis and appropriate management strategies.